is open 7 days a week from 8 to 5, 302-1900, 302-1900 is the Emergency Operations Center number. Many of your questions can be answered there, and it's also a resource for directing you in other locations for other resources and needs that you may have. So I wanted to mention that Monday through Friday. In addition, I've also been informed that Phoebe's COVID hotline, we have that number for you as well. They're open 7 days a week, and they're open from 9 to 5. You can dial that number. That's Phoebe's COVID hotline number. It is 229-312-1919. It's 229-312-1919, Phoebe's COVID hotline number. Today, we will not be taking questions from those of you who are in attendance today. Any questions you may have, we'll take those after the press conference. Okay. We will begin the press conference today by asking our Mayor, Bo Duro, to come up for some comments, and we'll move through our program. Mayor Duro.
Thank you, Chief. I want to first say, with the information, I guess the folks from Phoebe will give us information on the test. We're still, we know hundreds of people have been tested, but we only have, I believe, 144 results. Contrary to what rumors in the community are, it's a little better than 50% of those people are testing positive. I'm hearing from some people it's 90%. Well, that's totally inappropriate, totally incorrect. But one thing I just want to say today, and I'll move on, two things. First, there was a comment on somebody's Facebook page that said all these speakers are getting up and they're all touching the same podium and nobody's cleaning it. So I guess we need to exercise greater precaution. We have moved now into the next phase, which is shelter in place. I am familiarizing myself with these terms. We talked about self-isolation. Self-isolation is completely voluntary. Shelter in place is when some restraints are placed upon us by local, state, or federal government. And that is the phase we are in right now. So basically, we need to stay inside our homes, outside of permissible activities as defined in the ordinance. The chief requested that I just reiterate what precautions we need to take. First and foremost, now we've learned a new term the last couple of weeks, social distancing. Social distancing, try to maintain a distance of at least 6 feet when you're in the presence of other people. And that is because to avoid the spread of the virus, there's no question it's person-to-person contact, sneeze, the medical professionals will talk about that. This social distancing creates some type of barrier. Secondly, we need to be reminded to wash our hands with soap and water thoroughly several times during the course of the day. And there again, I'm probably stepping on the physician's feet here, but just let me say again, if you believe you might have contracted the virus, please do not go to the emergency room. What you need to do is contact your primary care physician, or Phoebe has opened up this hotline. We have the number, and you can get directions from there. If a medical professional feels that you should be tested, that you will in court be tested. Good news, and Dr. Ruiz will tell us about this, we have more kits that have come in, and also we are aggressively monitoring the results. One thing we've learned that at the hospital we are having more admissions as opposed to discharge, and the healthy balance, of course, is going to be if and when we reach a situation where more people are being discharged every day than being admitted. But that's all I have, Chief. Thank you for letting me have the opportunity to speak, and I'll move on. Thank you.
Thank you, Mayor Durham. Let's bring up the chairman now, Chairman Christopher Cohelis, for some remarks. Mr. Chairman.
Good afternoon, everyone. I want to continue to emphasize the words that Mayor Dura shared and also echo those as well. We do need to heed the call to remain sheltered at home. In other words, if you do not have very necessary business to conduct, either with a medical provider, with going to the grocery store, or taking care of another person, we ask that you just please stay at home. This is a very critical time. We are trying to arrest the development and the growth of this virus within our community in order to make sure that the resources that we have are not overrun. I have been in consistent contact with the governor's office, as well as our local, state, and federal counterparts, making them consistently aware of our situation. It is consistently evolving. I also recognize that many members within the business community have asked for clarity, and we will get additional clarity out to you on Monday regarding the restrictions that have been put in place so that we can best balance the desire to make sure that we continue to operate economically, but while also having appropriate restrictions to keep our people safe. Right now, our main objective is to keep the transmission of the virus down as much as possible. Additionally, I want to announce that we are very pleased with the fact that we have received a team from the CDC along with the Department of Public Health. That was after requests from our community were voiced directly to the governor's office and to other agencies as well. Those folks will be here in this community working to analyze and determine what the growth patterns are so as to best benefit our citizens. Additionally, I would continue to voice my request on behalf of this community as being a member of the Southwest Georgia Regional Community that our other elected leaders and officials who are in surrounding counties and cities, that they likewise enact similar provisions as we have done here in Albany and Daugherty County. I say that not to step on anyone's toes, but just to respectfully ask everyone to acknowledge that we are part of a region. We have many communities and counties and cities whose citizens come into Albany and Daugherty County each day. We need to make sure that we are taking the steps necessary in order to protect all of our citizens. The shelter-in-place order is necessary for us to adhere to safety precautions and the best evidence, the best advice from very smart medical professionals who are dealing with this across the world. So I would ask everyone, please take this very seriously and shelter in place. Thank you.
Thank you, Mr. Chairman. One other thing I'd like to mention, and I was speaking with Mr. Allen earlier, don't call 911 for COVID-19 questions or where can I be tested. We have provided a number of ways for you to get information about COVID-19, mainly by, first of all, calling the Emergency Operations Center at 302-1900 for information, and we can get you routed in those resources to you. But Mr. Allen wanted me to reiterate that we do not want to overload our 911 system with calls related to questions. If you have questions on the shelter-in-place ordinance that we gave out, you may call the Emergency Operations Center. We're standing by there to talk about whether or not a business should be open or social distancing. If you have any of those questions, we can answer those questions there without calling 911 for those questions. So I wanted to mention that, and I would like to bring up the chairman of the emergency department at Phoebe Putnam Memorial Hospital. Dr. James Black is here for some comments. Dr. Black.
Good afternoon. I'm going to bring an update on our numbers, and I felt like the mayor was speaking directly to me when he told me not to touch the podium. In an effort to not touch my face, as we've seen on Facebook, I was grabbing the podium so that I wouldn't touch my face, and I was committing another infraction. But we're all getting smarter, and we're all getting better about it. So far to date for the health system, and this includes all of our facilities, we have 83 positive results, 75 positive results, and as I was leaving today, we received another batch of results, so I expect this number to change. True, we do have about 50% of our tests coming back positive, but do realize in an effort to, number one, use the test appropriately, and for those who need it, we're not testing everyone. If we were to test everyone, then less than 2% of the tests would probably be positive, okay? The number would be much smaller. But again, by doing the screening and only screening those people who have significant illness or significant risk factors, plus other fever and so forth, shortness of breath, we're giving those tests to people that need it. But we also realize that just because you get a test doesn't mean you're going to be admitted to the hospital. Just because your test comes back positive doesn't mean you need to be admitted to the hospital. The majority of patients we're able to treat at home. We will continue to monitor those patients, but I just want you to have a reasonable expectation of how the testing procedure goes. I would like to also let you know that we're doing something not a lot of communities are doing. A lot of communities are trying not to test, okay? But we're choosing to test those people we think that is appropriate, and we're going to continue to take care of everyone. I think this is about all I had to keep you up to date, and we will continue to, I will tell you the number of patients that are deceased is 5 that we've had that have throughout our health system. So the total number is 5, 83 positive, 75 negative, and we'll keep you updated on those. Thank you very much.
Thank you, Dr. Black. I'd like to get an update or have us have an update from our Public Health Director, Dr. Charles Ruiz of the Southwest Health District. Dr. Ruiz.
And I want to thank whoever that was that pointed out to us that those of us here were not exhibiting the best practices. We're all learning, and we're learning to develop new habits as we go. So I appreciate that. My goal is to try to present an accurate picture, a realistic picture. I always like to find encouragement wherever I can, and I like to share encouragement, but I don't want to paint a picture that's too bleak, and I don't want to paint a picture that's overly rosy either. I want us to consider some of the facts and see how we can apply them to what's going on nowadays. So I agree entirely with Dr. Black when he was saying that that we are only testing a portion of those folks who are symptomatic, and again, primarily because the testing kit supplies are limited. But if we were to test everyone that's symptomatic, I think we would find that the death rate is much smaller than what we had originally thought. Now, one death is one too many, and one sick person is one too many. But to put it into perspective, sometimes it's good to look at some of the numbers. So I checked the Johns Hopkins website just a few hours ago, and at that time, in the United States, there had been 19,931 positive tests and 275 deaths. And that's 275 too many. If you do the math, that's about 1.3% death rate. A week, 10 days ago, we were looking at like a 3.8% death rate. So this, and it has steadily come down almost every day. It drops a tenth or 2/10 of a point. So with that trend, if it continues, and I think that it will, we're going to see that the death rate is nowhere near as scary as what we originally thought. But again, one death from COVID-19 is one too many. The threat that I think we need to keep our eye on right now, going beyond individuals who are ill and individuals who have lost their life. The immediate threat that we've got to stay focused on now is we've got to have adequate function of our hospitals. Phoebe Putney is very busy. There are other hospitals in the state that are very busy, and if the spread continues geographically, there are going to be other hospitals that will be stressed as well. So a very high priority is to use Phoebe Putney Memorial Hospital in the wisest sort of ways. We don't want to overload the emergency room because we need to have space for people who need to come in to be evaluated and then subsequently either discharged or admitted to the hospital. So I would submit that let's all try to do our part. Let's avoid unnecessary trips to the emergency room. I think we should even consider the type of activities that we pursue over the next few weeks. It's good for everybody to stay active and exercise and that sort of thing, but if you're involved in some sort of activity that has a high rate of accidents that might put you in the hospital, reconsider those types of activities, if you will. So with that in mind, and thinking about the importance of our healthcare personnel and our first responders, the Department of Public Health has tapped into a federal program that is allowing us to have some extra supplies here in Dougherty County. We received a pallet about 36 hours ago, several pallets of supplies, including personal protection equipment and kits that we can use to gather specimens to test people for COVID-19. So these specimen collections will be done free of charge, and we have piloted this program. We've done about 25 or so during the last 24 hours, and it's working well. We will start again on Monday, and we feel sure we're going to shoot for a goal of 50 to 100 on Monday, ultimately perhaps 100 every day, maybe even more. And the way to tap into this for anyone who is a healthcare provider or involved in the healthcare field, if you have contact with patients of any kind, not just necessarily COVID-19 patients, but if you have routine contact with patients, you would qualify for this free program. If there's someone in the healthcare field who maybe is off in a room somewhere, maybe doing clerical things or bookkeeping, and they never share space with the patient, that person really wouldn't qualify for this, but all others would. And then for first responders, EMS, firefighters, law enforcement, first responders qualify for this also. It's very important that we keep these people propped up and that we try to identify people who fall into these categories who are sick with COVID-19. Those folks will need to be isolated to protect those very important workforces. I'll give you the number to call starting at 1 p.m. tomorrow on Sunday. Our phone lines will be open and people can call in to see if they qualify and to receive an appointment. So the number is 229-352-6567, 352-6567. This line will open up at 1 o'clock tomorrow afternoon on Sunday. Probably will be open till around 5, and then it'll be open subsequently every weekday for people to call in and to make appointments to have the specimens collected. And the collections will be done here in Dougherty County at a site that we will reveal during the phone call. I have spoken with a member of the CDC staff. She is en route to Dougherty County as we speak, and we are eagerly anticipating the arrival of helpers from the CDC into the community. It is very important that we continue social distancing. I've been pleased as I've been riding around the community the last few minutes to get here that the streets don't have near as much traffic as normal for a Saturday. So I know that a lot of people are following the advice, but we really need everyone to follow that advice. Stay home, stay away from people if at all possible. And here we are on Saturday. It's important that we say again that it is a bad idea to gather for in-person worship. Hopefully, if you are a member of a house of worship, there's some method for continuing the practices of your faith through an online method or some other way besides getting together face to face. That's a risky thing to do. It puts you and your neighbor and the whole community at risk. If you're sick, by all means, stay home, isolate yourself as much as possible. Check on the needs of your neighbors. You may have neighbors with underlying medical conditions or people who are over 65 years of age. Perhaps you could offer to help assist them with obtaining food, prescription medication or some other supplies that they need. If you're a young person, it's safer for you to go to the store and do these kind of things than it is for someone over 65 years of age. We know this is a trying time, very difficult, and public health is here to support the community as best as we can. Through public health, Phoebe Putney has received a significant amount of supplies. We've supplied other hospitals in the area, and we'll continue to do that. We really appreciate the cooperation from the community. Thank you.
Thank you, Dr. Ruiz. One additional speaker today, I'd like to bring up the President and CEO of the Albany Area Chamber of Commerce, Ms. Barbara Rivera-Holmes.
Good afternoon. Barbara Rivera-Holmes, President and CEO of the Albany Area Chamber of Commerce. Today, I want to again thank our public partners, our medical professionals, our first responders, and the incredible work that they're doing to try and stem the curve of COVID-19. Life is absolutely precious, and this is our #1 priority. We can achieve this together by following the directions of our public health officials. Certain restrictions and actions have been put in place to protect the public good. They've also been put in place to protect our welfare as it relates to the business community. It is so important that our public heed this information, heed this advice. If we cannot flatten the curve of the virus, restrictions will continue to be put in place so that we can protect public health and ultimately also protect our economies. We were on the phone this morning with Marine Corps Logistics Base's Colonel Alfonso Trimble, and he used a phrase that I really appreciate. He said, our mission is to protect the force, and our force is our people, our healthcare providers, our medical professionals, our first responders, our workers, and our business community. The steps being taken are to protect the force. I am so encouraged by the partnership that we have with our public partners and our health officials in trying our best to combat this viral infection together. I'm also proud of the work of our businesses in being proactive and making modifications before they were put in place to protect the public health, to protect their workers, and to protect their businesses. And they're doing so in ways that are also very innovative. Pretoria Fields Brewery, for example, has repurposed its brewery barrels into hand sanitizing making operations. That is an incredible way that our business community is partnering in order to do the right thing. We, the Albany Area Chamber of Commerce and its board of directors, are calling on our regional businesses, on our regional partners at other chambers of commerce, and on our regional communities to work with us so that we can together tackle this situation. Our borders are not porous. They should not be. While they are geographical, they are porous, and we live in this situation together, and we do so symbiotically. Albany is the leader of this region, and we call on all of our partners to come together so that together we can move forward. I want to thank the public for its support of our business community. There are still ways to get the essential goods and services that we need in order for life and business to continue. Those are in place safely. I want to thank our businesses for all that they are doing. We know that this is hard on everyone. This is an unprecedented situation, and everyone is doing the absolute best that they can, making the best decisions with the best information available. I am proud to lead you, the business community, in this effort, and so proud of the work that we are doing together to get through this. Thank you.
Thank you. That will conclude our press conference for today. We will again see you tomorrow at 1 p.m. for our 1 p.m. Press conference on Sunday. Thank you.